Good afternoon, everyone, and thank you for joining us. We are so excited to share with you a project we've been working collaboratively on for a while now. My name is Alicia Nelson. I'm the director of the Governor's Recovery Ohio Initiative. And for those of you who don't know, Recovery Ohio is a state initiative commissioned by our governor that brings state agencies, organizations both public and private, together to collaborate to help families lead healthier lives. The governor has had a passion for helping those with substance use and mental health conditions for the entirety of his career, and continues to make it a priority in this administration. What we know about Ohio and Ohio's addiction crisis is that it will take all of us to combat the issue. Our governor and all of those who are working on this important topic, like the Ohio Opioid Education Alliance, are dedicated to doing all we can to save lives. Recovery Ohio is advised by an external council, the Recovery Ohio Advisory Council, and one of our council's first tasks was to take their knowledge and experience from working in this field or dealing with mental health and substance use disorders in their families and with their loved ones, and develop the Recovery Ohio initial report. This report contains 75 recommendations, ranging from stigma and education, prevention, treatment, crisis support, and more. We have used this report since March of 2019, along with the guidance of our council, to guide the work of Recovery Ohio. Recommendation number 1 in this report is to create a statewide campaign to address stigmas against people with mental illness and substance use disorders. The report emphasizes the need for the campaign or for a campaign to end stigma and provide a constant reframing of mental illness and addiction from a moral failing to a chronic illness. In our governor's first executive budget, we made a commitment to devote $9.75 million to educate Ohioans about these diseases. Today is a result of that investment, and we could not be more excited to partner with the Ohio Opioid Education Alliance, led by the Nationwide Foundation, to reveal this campaign that aims to reduce stigma and promote wellness in every part of our state. With that, I'm pleased that Governor DeWine and Nationwide CEO Kirk Walker are here with us to tell us more. And Governor, I can't thank you enough for all you've done for myself and my family and all Ohioans who are struggling or looking to support individuals and loved ones with behavioral health needs in our state. With that, thank you.
Director, thank you very, very much. And thanks for the great work that Recovery Ohio is doing. We launched Recovery Ohio as one of our first initiatives after I became governor. Through this initiative, I challenged the directors in my cabinet to come together and use the resources of the state to accomplish the following. First, enhance supports for those struggling with addiction and those struggling with mental health conditions, and to support their families. Second, to elevate and expand the state's prevention and education efforts. And 3, to support local law enforcement in their efforts to rid our communities of illicit drugs and fight back against the drug cartels. As a state, Ohio has been hit hard by addiction. Thousands of Ohioans live also with mental illness. Experts in the field of addiction and experts in the field of mental illness understand that these are diseases. They're not a sign of immoral failing or a weak character. Too many people, though, don't understand that, and the result is stigma. An unfair, unjustified disapproval of people living with addiction or mental illness. Stigma can be devastating to those who are living with these diseases, not only adding to the hardships of addiction and mental illness, but also preventing them from seeking the help they need to get well. That's why in this initial report, Recovery Ohio team indicated that its most pressing need for a statewide campaign to address the public stigma that Ohioans face when they live with a mental illness or a substance abuse disorder. This new education campaign that we're announcing today answers that call and will attack stigma directly. The Beat the Stigma campaign will encourage Ohioans to challenge what you think about addiction. When you see someone who lives with addiction, there's always more to the story than you know. Know your risk. If there's a history of addiction in your family, know that this increases your risk for addiction. Understand your risk and talk to your children about what this means so they can make informed choices. Finally, take care of your mental health. Mental health challenges can put you at risk for substance use. We know that an education campaign alone isn't going to fix the problem, but education is a key component. It really is a key component to the solution. And that's why we think this is such an important investment. Thanks to all of you for being here, and I'll ask Kurt Walker, the Chief Executive Officer of Nationwide, to explain more about the campaign. I'll tell you, I was impressed with the leadership of Kurt and Kurt's team 3 years ago in a Central Ohio-based campaign to tackle the prescription opioid problem. It was called Don't Live in Denial. You probably saw those ads. I thought it was very, very impactful. I asked the same team to help us bring the same level of insight and discipline to the campaign that we're unveiling today. Very proud of this work because it is really, I think, a great example of what can be accomplished when both the public and private sectors join forces to tackle these issues. Now, Kurt is going to talk about how we've arrived at this campaign that we are unveiling today. Kurt? Thank you.
Thank you, Governor DeWine, for partnering on this important work. The campaign against stigma we're announcing today is being led by the Ohio Opioid Education Alliance. And as the governor mentioned, and if you're not familiar, the Alliance is a unique private-public partnership that came together in 2018. It started as a collaboration with the Alcohol, Drug, and Mental Health Board. We often refer to it in Franklin County as ADAM-H. We're all focused on a common goal: to help address Ohio's opioid crisis, and working together, as the governor mentioned, we launched Denial Ohio as a campaign. And also, as the governor mentioned, the Nationwide Foundation contributed funding and people and talent and resources to the important issue, but it's especially important that I call out, it just wasn't nationwide. More than 100 companies and organizations from across the state have joined to form the Alliance, provided resources, time, energy, and we're all focused on the same thing. We need to address this crisis. The original funding, plus additional significant contributions from the business community, helped to create the Denial Ohio public information campaign. Many of you have seen it, either on TV or social media, and we're proud of the work that was done, specific to Denial Ohio. But since that time, the state of Ohio has experienced other challenges, and those challenges have been accelerated by the pandemic. Many Ohioans are also struggling with mental health. This new campaign from the Alliance focuses on the harmful stigma that surrounds addiction and mental health. Let me repeat that to everyone. This new campaign from the Alliance focuses on the harmful stigma that surrounds addiction and mental health. We're involved because we recognize it's as much as a workplace issue as what it is at home in our communities. And Ohio's business community wants to make a difference. We want to be a part of the solution from an addiction and a mental illness standpoint. We care about the well-being of Ohio's employees, and we also recognize that addiction and mental illness cost businesses not only time, but resources. So I'm proud from a nationwide standpoint that the Nationwide Foundation is investing our resources to help people overcome the stigmas of addiction and mental health. And we also haven't entirely solved the problem as it was originally presented, But we know that our programs are making a difference in our communities. And across Ohio, businesses feel an obligation to share our best practices with others in the Alliance. We're also strong believers in the strength of public-private partnerships. It's one of the many things the state of Ohio does so very well. And when Governor DeWine called and asked, hey, would you be willing to share your marketing expertise one more time? We're humbled to answer the call. So I want to thank the governor for the collaboration between our teams and the priority that the administration has given to this challenge. And it's all about investing in the well-being of mental health of Ohioans. So it is now my pleasure to introduce Lori Chris, Director of the Ohio Department of Mental Health Addiction Services, to share more about addiction and mental illness. Lori?
Thank you, Mr. Walker. Now more than ever, there are unprecedented pressures facing the health of Ohioans in our big cities and in our rural counties. 1 in 13 Ohioans is living with or recovering from a substance use disorder, and many Ohioans are struggling with mental health issues. People who are living with and recovering from mental illness and addiction face harmful stigmas. They and their families are often judged, misunderstood, and isolated. The reality is, addiction is a disease, much like diabetes, cancer, and heart disease. Addiction is caused by a combination of factors: behavioral, psychological, environmental, and biological factors. The same is true for mental illness. In fact, the genes each of us are born with account for about half of our risk in developing addiction. Moreover, mental illness and addiction frequently overlap. When a person lives with a mental illness, they can be more prone to substance use disorder and addiction. The public service campaign we're here to unveil today was created through a private-public partnership with our department, the Ohio Department of Mental Health and Addiction Services, Recovery Ohio, the Alcohol, Drug, and Mental Health Board of Franklin County, the Opioid Education Alliance, the Nationwide Foundation, and in-kind resources from Nationwide's advertising department, the same team that developed the Denial Ohio campaign. Much like the Denial Ohio campaign that depicted a fictional town ignoring the reality of the opioid crisis, this new campaign, called Beat the Stigma, uses a fictional game show to address stigmas about addiction. What you'll see is 3 contestants playing Beat the Stigma. When their knowledge of addiction is put to the test, they think they have all the right answers and jump to conclusions, missing what's clearly right in front of them. The campaign uses this clever game show approach to break through and grab our attention while also addressing the stigmas and misconceptions we often hear about addiction. In fact, all of the stigmas that you'll hear in these PSAs are based on research we did with people in recovery and their families. These are actual stigmas that they have faced. We're going to show you the ad now. We'll roll it twice for you to watch so that you can digest the content. So let's roll the ads.
Research shows that this is responsible for 50% of your risk for alcohol addiction. Cameron.
Making bad choices.
That's not it, Cameron.
Lack of self-control.
We're looking at the same words, right?
Hanging out with the wrong people, Jeff.
We're gonna end it there. All your answers were stigmas, so you did not beat the stigma.
Ohio, challenge what you know about addiction.
Research shows that this is responsible for 50% of your risk for alcohol addiction. Cameron.
Making bad choices.
That's not it, Cameron.
Lack of self-control.
We're looking at the same words, right?
Hanging out with the wrong people, Jeff.
We're gonna end it there. All your answers were stigmas, so you did not beat the stigma.
Ohio, challenge what you know about addiction.
Great, fabulous ads. Congratulations to the creative team who is bringing that to us. All Ohioans will be engaged with this campaign. They will see it robustly throughout the state of Ohio beginning next week. And thank you, Director Chris, for your leadership and partnership. I'm Chad Jester, president of the Nationwide Foundation, and on behalf of the 100-plus businesses and organizations that make up the Ohio Opioid Education Alliance, we're very excited to bring you this new educational campaign. We know ads alone will not resolve the challenges that stigma creates for those among us battling addiction or mental health issues. But through our past work on the Don't Live in Denial campaign, we do know that education is the first step to changing individual behaviors. And we know that changing individual behaviors leads to broader change over time. When we jump to conclusions and make assumptions, like the contestants did in these new PSAs, we're furthering harmful stigmas. To put it simply, stigma isn't a game. These new PSAs and accompanying radio PSAs and billboards will launch next week. The calls to action for all of us as Ohioans are simple and straightforward. First, challenge what you think about addiction. When you see someone struggling with addiction, there's always more to the story than what you know. Practice empathy, not judgment. Again, let's say that again. Practice empathy, not judgment. Secondly, know your risk. If there's a history of addiction in your family, know that this increases your risk for addiction. Know your risk and talk to your kids about what this means so they can make informed choices. And third, take care of your mental health. Mental health challenges can put you at risk for substance abuse. Here to talk more about the challenges facing Ohioans each and every day are two individuals on the front lines. First, I invite Erica Clark-Jones, Executive Director of the Franklin County Adam H. Board, to join us. Erica?
Thank you, Chad Jester. Hello, everyone. Thanks for being here and allowing me the opportunity to provide additional context for this effort. As stated earlier, we know that 1 in 3 Ohioans struggles with addiction and a similar number have mental illness. In fact, many people live with both. Addiction and mental health issues are rooted in disease, not character flaws or a failure of willpower. From the Adam H. Board perspective, this characteristic cannot be overemphasized. In contrast to previous decades, we now know that the influence of family history is critical. 50% of an individual's risk for developing addiction is determined by your genes. If you have a family history of addiction, your risk is higher. If you knew your child had an elevated risk of any other serious disease, wouldn't you talk about it with that child? The same should apply to addiction and mental illness. The only reason not to talk about it is the value judgment that too many of us are willing to make and the conclusions we often jump to. Others have mentioned stigma. Stigma makes things worse by discouraging people from seeking treatment. And that may be especially true in Ohio. In a recent survey by the U.S. Centers for Disease Control and Prevention, 11.2% of Americans said that they needed more mental health counseling in the previous 4 weeks, but did not get it. Among Ohioans, that figure was 15.1%. Experts consider needing but not receiving treatment a proxy variable, or an indirect way of measuring stigma around mental health. A separate survey conducted each year by the Federal Substance Abuse and Mental Health Services Administration tells a similar story about substance misuse. In the 2018-2019 survey, nearly 40% of Ohioans reported needing but not receiving treatment for alcohol use. And 31% of Ohioans reported needing but not receiving treatment for illicit drug use. In Franklin County, a consequence of that statistic is overdose deaths climbed 47% in 2020 to more than 800 individuals. For individuals in underserved and ethnically underrepresented communities, stigma only adds to the struggle of accessing quality mental health care. According to the Centers for Disease Control and the Office on Minority Health and Health Disparities, in addition to income, stigma is one of the top barriers to treatment. The pandemic has served to amplify these issues that were already there, and the needs continue to grow, making overcoming stigma a critical first step to linking individuals in need with care. We know that 21% of Franklin County's 1.3 million residents will experience mental illness in a given year, and 10% will abuse or be dependent on drugs or alcohol. We also anticipate a 23% increase in demand for mental health and substance abuse services over the next 10 years. These are just a few of the issues on the horizon for the Columbus and Franklin County area. These problems affect all kinds of Ohio communities. My colleague, Greta Mayer, Director of the Recovery Board of Clark, Greene, and Madison counties, will now talk about the special challenges that face rural Ohio.
Thank you and good afternoon. I'm so pleased to be here among those who've come together and joined forces and have done so much to battle one of the greatest social and health issues of our time. My agency serves a part of Ohio that's been hard hit by the opioid crisis and its twin plagues, the diseases of addiction and mental illness. In our part of the state, stigma applies to entire communities. And this message, challenge what you know about addiction, is desperately needed in rural areas where resources for treatment and education are especially limited. Even when people with addiction or mental illness receive the needed treatment to recover, stigma can undermine that progress of recovery if it interferes and prevents them from finding a quality of life, getting a good job, finding stable housing, and healthy relationships. Stigma is a problem in all four corners of our state, and this message needs to be heard in all of them. We believe the people you're about to meet in this video deliver that message loud and clear.
I didn't choose to be a drug addict. Like, that's not what my purpose was in life. I just feel like if the world was a little more educated on, like, the disease part of addiction, then maybe they would have a little better understanding.
That's when I really felt helpless and low, you know, because I felt like nobody understood me, nobody cared, everybody's judging me, everybody's just looking at me, and, you know, it hurt. When I wasn't talking about it with someone, I was battling it by myself. And I kept losing, and I kept losing, and I kept losing.
I've been told that my son's death is Darwinism, that is the thinning of the herd, that if they found him overdosing in the street, they'd step over him and keep walking, all because my son had a mental illness.
So many people see are just damaged, whether they were hurt by their family, whether something happened to them, and they've never been forgiven or more or less forgiven themselves. Most people who come through our specialized dockets aren't bad people. They're not hardened criminals. There's somebody who's put in that position for some reason. All these things we see have attributed to their mental health issues, which often heads to addiction issues.
The way that I think about it sometimes is if you have a toothache, you go talk to somebody about it, whether it's your parents or your dentist, and you mention it and you take care of it before it gets out of hand, right? But what if, you know, we treated that toothache the same way we treat addiction? You know, what if that person felt ashamed about having a toothache and they just didn't talk to anybody about it, and then a few months later that tooth has to come out? You know, that's a permanent, situation to be in. You no longer have a tooth. My situation, I no longer have a brother. I think he would still be here today if that stigma and shame around addiction just didn't exist anymore.
The more attention that we can bring to this problem, I think the better, because there's still a great deal of stigma out there that says, hey, you have a substance abuse disorder, you're looked upon like you're a lower class citizen in our community.
We got to talk about this stuff. I mean, whether from the pulpit or in teen groups, as I've done many times, or in public forums, you got to start talking, first of all, and you've got to be real with people, and then you've got to start listening.
Until we as a society accept that our brain is an organ just like the heart and the kidney and anything else, and it controls all of that, and it can be diseased.
We have to look at people as human beings. I think that's the worst thing we do is we look at them, oh, they did this, they're bad. Oh, they were this person, they're bad. Look at them as who they are and what they're worth. Everybody has a worth and everybody has a value. And we should look at those values and stop just assuming what we know about somebody. Take the time, talk to them. That little kindness you show somebody might make a huge difference in their life down the road.
Hi, I'm Ryan Day, head football coach at The Ohio State University. Both my wife Nina and I know about mental health issues and how they can affect anyone. This is why we established the Christina and Ryan Day Fund for pediatric and adolescent mental wellness at Nationwide Children's Hospital. I never spoke about my experiences for many years. It's not a sign of weakness to ask for help, nor should it be embarrassing. Asking for help is a sign of strength. Condemning those living with diseases is not the answer. Addiction and mental illness can affect anyone, regardless of their moral character, willpower, or place in society. Nina and I are proud to lend our support to this initiative because it describes addiction and mental health issues as what they really are: diseases worthy of our empathy, energy, and resources, not our judgment.
Wow, that is a powerful, thought-provoking video. Thank you to those who participated in sharing their story and sharing their messages. They are representative of many, many Ohioans we are out to help with this new initiative, Beat the Stigma. We just saw a startling picture of the harm that addiction and mental health stigma is doing to Ohio communities and how the message of this campaign could change that. We want to deliver this message through as many channels as possible: broadcast television, streaming services, radio, outdoor advertising, digital and social media. We're here to invite community partners and leaders to join us in making this happen. And we're calling on the business community and foundations in Ohio to financially support the campaign as well. We also invite the many, many concerned community organizations throughout the state to support this effort by joining the Alliance. And we call on all of you as you go back to your families and into your communities to begin thinking and talking about addiction and mental illness differently. That is truly the best way we can aid and support the recovery for those who are living in hell each and every day. I thank all of you for attending today, and I thank members of the news media for your interest. We'll be glad to take your questions now regarding the new campaign. If you could please use the chat in the media feed to identify yourself, your outlet, and whom you are directing your question to. We will take everyone's questions one at a time. We have our first question in already, so I'll read off my iPad, invite each one of the presenters who the question is directed to back to the podium. So the first question is from Bryant Somerville, WBNS 10 TV. Wondering about the Denial Ohio campaign starting up about 3 years ago. What does Beat the Stigma look to do that the Denial Ohio campaign did not, and how? So I'm going to invite Ramon Jones, Nationwide's Chief Marketing Officer, up to the podium to respond to the question. Ramon?
Thank you, Chad. Thank you for that question, and terrific job across the board to all of our presenters today. The Beat the Stigma campaign is the next iteration of holding up a mirror to Ohioans as we challenge not just the opioid crisis, but we're actually opening the aperture to address other issues such as mental illness. There's probably more similarities than differences between these two campaigns, and the fact is we're asking each person to look in the mirror and challenge again what you know about addiction. And so as the campaign rolls out, and as you've already heard, and as you've already seen by the ad that we've run, we're going to continue to ask provocative questions so that Ohioans challenge what they know about addiction. Thank you.
Great, thank you, Ramon. For the second question, Corey Sharber, Cincinnati Public Radio, for the governor. And Corey, if you could please unmute and turn on your camera, we can capture you in the room asking your question.
Good afternoon, everyone. According to Harm Reduction Ohio, overdose death rates for Black residents have been outpacing white residents since 2018. What ways is the campaign looking to address Ohio's Black residents?
Well, this campaign, the ad is one component part, but you're going to see other things that are done. You know, we have seen an increase in the deaths during the pandemic. For example, the number of overdose deaths certainly increased. And there's a lot of different things that, you know, we are working on as far as our different departments. So I'm going to ask Alicia if you want to come up and talk a little bit about, you know, because this is one component part of many different things that are going on. But I would just say about the ad itself, I think the ad has universal appeal. I think it drives home the message about stigma. Stigma knows no bounds as far as the victims of stigma or as far as the people who you know, have attached the stigma to this addiction. Alicia.
Thank you, Governor. And it's a great question. And I think I agree with what you've said so far in that this campaign will make an impact on all communities, and stigma is real in all communities. And so we really are asking everyone, I'm asking my family, to challenge what we know about addiction and really have those hard conversations in the faith community, in the home, in the school, to make sure that we're addressing the needs of all of us. And so we're excited about this campaign, but our work doesn't stop there, as the governor mentioned. We want to make sure that we are coupling this campaign with prevention efforts, harm reduction efforts, treatment, and all of that has been targeted to make sure that we're reaching communities of color in an intentional way. So thank you.
Great, thank you, Director Nelson and Governor DeWine. Also going to ask Ramon Jones to come back up to the podium. This campaign is heavily researched. So the team at Nationwide, the creative team, did a tremendous amount of research talking to Ohioans who've been impacted, their family members, and the general population in Ohio. But Ramon, if you could speak to the discipline that went into the research to drive this creative, I think that would be helpful.
Certainly, and I perhaps should have addressed that earlier. Both campaigns are rooted in substantial research. So not only have we spoken to those who are subject to the stigmas, but we've also talked to the stigma holders. We've talked to mental health professionals. We've talked to frontline service professionals. We've talked to the families of those impacted by opioid addiction and mental illness. And in having those conversations and evaluating campaigns across the country that have taken an attempt to address this issue, we've distilled key insights that we're looking to utilize the campaign to, again, bring the message to all Ohioans. Again, as I mentioned earlier, we want to hold up a mirror to the average Ohioan and ask them to challenge what they know about addiction.
Thank you, Ramon. So again, the creative really does a wonderful job based on the research of having the camera shown on ourselves as the stigma holder, really challenging ourselves and what stigmas we may hold. So we're taking the camera off those who are suffering and really asking ourselves, are we in a place where we need to be as an individual? Do we understand the struggles to the extent that we should? Are we developing the empathy and the compassion that we should have for those who are struggling? Next question is from Sam Zern with the Canton Repository. Sam, if you could unmute and come on camera, please.
Hi, y'all. Thanks for doing this today. I just have a clarifying question.
So you mentioned that there are other things other than the campaign that you're working on. Is the $9.75 million just related to the campaign, or is it covering anything else?
Sam, thanks for the question. The $9.75 million investment from the state of Ohio will be complemented by private investment. It is going into the campaign creative, campaign purchasing, and activation of the campaign. The goal of the campaign is to be robust throughout the state of Ohio, reaching every corner of the state, all 88 counties, with every medium that I mentioned earlier, from social to the ads themselves. But the Alliance will also be on the ground in each community around the state, engaging Erica, engaging Greta and their peers throughout the state of Ohio, and others who want to be involved in this work. The effort really has to be at the grassroots to make sure we're reaching people and we're destigmatizing as much as possible. So all the dollars will be towards those efforts. Ramona, is there anything you would like to add?
Thank you, Chad. No, I think you pretty much addressed it. In order to effectively cover the state, in order to effectively reach as many Ohioans as possible, we're using a variety of tactics. And so you saw one today, you saw the ad, but we also will be using out-of-home billboards. We will go heavy into digital and social. And as we roll out other extensions, if you will, of the campaign, we will continue to use messaging to address those that we think are most susceptible and open to receiving these messages. And so that's the primary approach.
Great. Ramona, if you could sit tight for a second. One thing I'll add, Sam, to your question is, we're going to roll this campaign out shortly, so within the next week or so. But throughout the campaign, we are going to do a lot of research to make sure that we are reaching Ohioans in the way intended, that we are changing the mindset around stigma, and we'll make tweaks along the way, I'm sure. That's one thing we learned from the Denial Ohio campaign, is that we've got to be constantly learning. These issues are complex. They're meaningful to a lot of Ohioans. Actually, every Ohioan may hold stigmas that we want to try to change as we turn that camera on ourselves. So the dollars are going to be invested to stand up the campaign, but consistently we're going to push ourselves to make sure that we're delivering the right message.
And Chad, if I could, I just pulled up a bit of research that came out of some of the work that was done to bring this campaign to life. And so I mentioned we started several months ago. We found a couple of misconceptions out there as we dug into the research. And the first one was that addiction only happens to a certain type of person. And what we know and what we found in our research is that, quite frankly, it could happen to just about anyone. We found that there was a misconception that people who use substances are less than. And again, as we know and as we found by talking to mental health professionals, that is actually not the case. All of us are subjected to it. Addiction is a moral failing in the choice. That was the third misconception that we found in our research. And as you see in the piece, we addressed that specifically in the ad. The fourth misconception, addiction is not treatable. Well, you've heard from some professionals today that would disagree with that substantially. And we will aim to look to address that as we roll out and go further into the campaign. And then the last one, which I thought was really insightful, there's a misconception that recovery is linear, meaning you start recovery and there's a certain end spot. And each path is different. Each person is different. Each issue that we're managing and dealing with here is different. And in all of the families that we talked to as part of this research, that confirms that. And so we'll look to address some of these misconceptions as we go further into the campaign. Thank you.
So, Ramon, everything you just mentioned is really right on point with the stigma Ohioans may hold today.
That's exactly right. And so we're looking to this campaign to help address that the stigmas that people hold by challenging what you know about addiction and mental illness.
So one thing while you're still at the podium that I'll mention as well is we will have a site that is beatthestigma.org that is live, and you can go to beatthestigma.org to get additional resources and really start to ask your question of yourself about challenging your stigmas around mental health and addiction. But the site is meant to be a resource for all Ohioans. It's continued learning, self-reflection. But Ramon, your team's putting that together as well. Anything you want to mention about the site?
It should go live today. And as the campaign rolls out and as we roll out more assets that are part of this campaign, we'll continue to add not just insightful ways to interact with the campaign, but a substantial educational element to it as well.
Great, thank you so much. Now you're wondering if I'm going to keep you at the podium asking you more questions, I'm sure.
That's what I'm here for.
That's what you're here for. So I think we've addressed all the questions from the media members who are with us today. We want to thank the members of the media for being here for the kickoff today for the Beat the Stigma campaign. Again, a few key takeaways. This is a collaborative statewide effort. The state of Ohio is a fantastic partner. We have the Ohio Opioid Education Alliance, more than 100 organizations. As we mentioned earlier today, the door is open for others to join the alliance, to utilize your network, your expertise, to help share the message with others throughout the state. We're also going to be approaching businesses and foundations to be investors in the work as well. We want to consistently reach Ohioans with this message. We are going to be available to members of the media ongoing as we learn more, as we roll out the campaign itself. This is ongoing iterative work that is complex but extremely meaningful. So thank you to Directors Nelson, Director Chris, Erica Clark-Jones, Greta Mayer, and of course Governor DeWine and Kurt Walker for your participation today. Very much appreciate it. Thank you, everyone.